Welcome to Chats with the Chief. I'm John Jensen, Chief of Staff at the Veterans Health Administration, and this is the podcast where we make small talk about the largest integrated healthcare system in the country. This week, I'm joined by Dr. Jonathan Perlin, former Undersecretary for Health, longtime advisor to VA, and newly appointed President and CEO of the Joint Commission. Enjoy the show. Dr. Perlin, thank you so much for being with us today. Thank you for taking time out of your very, very busy schedule to be with us. I know you're a former Undersecretary for Health, sincere advocate for veterans and the Veterans Administration, and newly appointed as the President and CEO of the Joint Commission. So thanks for being with us, and thanks for taking the time to talk with us today.
Well, thank you so much for the invitation. It's great to be back at VA. The mission drives us all, and so you never really leave. Don't want to miss the opportunity really to say thanks to you for what you do. And I know we chatted about this before, but those individuals who are serving veterans across the health system, great big thanks for doing what they do, and especially during this period of COVID.
Yeah, and thank you for saying that, but also continuing to be an advocate for VA and veterans. And since your time here, you've come back a couple of times, and you continue to be with us as a senior advisor. And I know you're getting ready to move into even brighter territory. So we wanted to have a chance to sit down and talk to you before you do that. But before we really dive into the very, very tough questions, we always like to get to know our guests a little bit and to tell our audience a little bit about yourself. So I'll leave the floor to you to talk about yourself and your family, or kind of what you do.
Yeah, well, I have a new role as you mentioned, as the President and CEO, seventh President and CEO of the Joint Commission. And I want to say to all my healthcare colleagues that those rumors of daily surveys, just not true, won't happen. But excited to be able to influence quality of healthcare through that, not only domestically, but through Joint Commission International. I'm very fortunate. I'm married to a pediatric emergency physician. I can't believe it, 31 years.
Oh my goodness.
If she were here, she'd say, of course, she was a child bride, so don't do the math. Just get me in trouble. I have a son who's neuroscience biomedical engineering, and a daughter who's a second-year law student.
Oh, wow.
And a little cockapoo who runs the household.
Of course, that's what they're there for. Well, welcome again. So
Thank you.
A couple other questions that we always ask is really more in the kind of what are you reading, doing kind of thing. So one of the first questions is there a book, TV show, or movie that you're watching or reading that would interest others that we may want to share and or pick up?
Well, I'm reading three things. I tend to start books and not quite finish them, so I've got three things on the table right now. I'll start with a fun one. It's Taste. It's Stanley Tucci's sort of gastronomic tour of Italy. And it's a really dangerous book. It's really well written, it's really funny, but you shouldn't read it if you're trying to lose weight, because it'll just make you hungry. So that's a great read. You may have seen a show on TV.
Yep.
The second one of the areas that I'll be taking up, and maybe we'll talk about, is decarbonization or sustainability. And there's a science fiction book that's been recommended. It's by Kim Stanley Robinson. It's called The Ministry of the Future. And it's incredibly well researched, and it sort of portrays a dystopian world 50 years from now, not so far in the future, about what could occur geopolitically if we don't change the way we emit greenhouse gases. So it's a pretty sobering book. Actually, it's one that Barack Obama said one of his 10 most important reads of the year. And then the third one I'm reading, also sort of a serious book, is the one I've actually almost finished. It's called Unscaled, and it's by a guy named Hemant Taneja. And his thesis is that the world is changing based on three things: that new players can unseat the incumbents in big industries, sort of like Uber to taxi cabs, or otherwise. And it's the convergence of artificial intelligence plus social cloud computing, plus, really those three things: artificial intelligence, cloud computing, and social networking. And the ability to have a new business that can gain traction by virtue of bringing together capacity that in the past used to belong to those organizations that had, massive physical infrastructure and large, deep capital reserves, suggested that this is an era where change will be accelerated. And Hemant Taneja, and the book is Unscaled. Really one of the best reads of the last year.
It sounds amazing, and you really talk about what's happening in the world today. I think the Uber taxi example is great. I mean, right outside of this door, I used to be able to catch a taxi when I worked on the Hill, and you can't find a taxi hardly today. You take an Uber, and that wasn't that many years ago, 5, 6 years ago. Things have changed so significantly. Definitely going to look up that book.
Great book.
For sure. Next, what is something that's interesting or unique about you, or a hobby that you do that you would want to share?
Well, probably the thing that I would never expect is that I'm a car guy. And, you've seen me in undersecretary and other roles, but I grew up next to an older fella in Baltimore who had bad emphysema, and I was his hands and learned to work on cars. So I love tinkering on cars, and that's been both a passion and an area of just countless hours. That and having spent 16 years nearly in Nashville, learned how to play guitar.
Oh, interesting.
But, do I perform? The answer is no. There's equipment in Nashville. What do you call an aspiring musician in Nashville? Doctor.
Nice.
So was aspirational, but it's just a hobby.
That's still great, though, to pick up guitar, let's not say older, but not younger. It's difficult sometimes to pick up some of the interests, violin, fiddle. I've always wanted to try and play that, but as I tried to venture that way, there's a lot of hand-eye coordination that was missed out when I was younger, evidently.
Well, I didn't necessarily intend to, but my daughter, when she was younger, sort of challenged me. She didn't want to come straight out, as children will do. They didn't want to ask for guitar lessons or getting guitar. So she kind of set it up. She said, "I will if you will." And I surprised her and I said,
nice.
"Okay." Well, she didn't keep with the guitar, but my son did. And actually, so did I.
That's fantastic. See, there's something unique we didn't know about. And lastly, kind of our warm-up questions is, and really looking forward to this response actually, is there a saying or a quote that you've heard or something that just really sticks with you, or maybe something of your own, that you always fall back on, share with your teams, leaders, et cetera?
Yeah, well, that's a really important one. I think over the course of my career, I learned a lesson that saying yes to opportunities begets more opportunities. So the quote is, just say yes. I know we're taught about work-life balance, and I know particularly during this challenging period, work-life balance is extraordinarily problematic. Yeah. But if you want to have opportunities, there's this thing, and Jim Collins writes about it in Good to Great, it's called factor of luck. When you say yes, you create an opportunity. Yeah. And inadvertently, if you say no, you might close doors. Because the person that you say yes to will think of you the next time, and one opportunity creates the other opportunity. And that's what really Collins is referring to for individuals or organizations when he talks about factor of luck. So it's just say yes.
I love that. And we recently had a conversation in our own kind of space about how do you get to that in this kind of new work environment that we're dealing with, specifically here in central office. I know much of our field hospitals are in person, but how do you create these opportunities for the yeses? How do you create the opportunities to develop new leaders? And I know we can talk about that a little bit more in depth later, but it's a new challenge that we never really had to face before, but appreciate hearing. I can firmly believe that in that also. I have a 25-year Army career, and contrary to everybody telling me when I win never volunteer for something, I did, and had a wonderful career after volunteering and saying yes.
Yeah, well, you're proving the point,
yes.
And thank you for saying yes, because without that you wouldn't have ended up here, and I think that's really the point of that. But I have this challenge too, coming into a new organization, and a lot of activity is heavily virtualized. Now, you don't want to take knowledge workers, have them come into a physical plant and be on Zoom or WebEx or whatever the flavor is. But you want to create exposures for new members of the organization. You want to transmit culture, and you want to create opportunity. And for me, one of the things I've tried to do across the different roles that I've been privileged to have was to ask individuals who are at lower levels of the organization, particularly if you're committed, as I know you and the secretary and the department are, to creating opportunities for equity and inclusion.
Yeah.
Taking people from more junior ranks and giving them the opportunity to say yes to a committee or an activity, a work group that actually is at a much more senior level. It creates exposure, and I think we've got to be even more intentional about that as virtualized or as hybrid as we are.
Yeah, and I really appreciate the word intentional. That's really became my catchphrase lately. It's all about intentionality. It's intentionality about bringing folks along. It's about asking them and creating opportunity, which the VA does in so much better way than many other, specifically federal organizations do. There's opportunities galore, and sometimes you just need to say yes, I guess, to stay along in the phrase.
Yes, indeed.
So let's jump into a little bit about Dr. Perlin. This is not a roast, and so we won't go down that far. But I do want to kind of start at the beginning. And you've had such an illustrious career and such really the gamut in leadership in healthcare. And I always like to know this, and it's funny that you mentioned about kind of having a passion for cars. How did you first get involved in healthcare? How did that become the thing that you wanted to actually do?
Yeah, well, I'm the son of a physician who was able to have his education by virtue of his service in the Navy. And his career took many twists and turns, but it was very much oriented toward service. He ended up being a psychiatrist, and some of my formative experiences were in Baltimore, where in the late 60s, early 70s, against the sort of dominant hospital model, he was setting up community mental health clinics. That was quite an impression. So I kind of knew early on that I was going to end up in medicine, but I had really good counterculture advice. It was do something you'll never have a chance to do again. And I loved reading, and I was interested in ideas, and so I was actually an English and philosophy major, which is not the usual trajectory.
Right.
But that was that was really helpful in terms of the subsequent roles. And going from philosophy, kind of got interested, getting back to medicine and how the brain worked, and so I ended up in a neurobiology lab doing molecular neurobiology, looking at mechanisms of memory. You might say, okay, well, how did you go from there to health administration? Well, it's an epiphany event where I can tell you the moment my career changed. And maybe this is one of the other pieces of career advice, is that you got to follow your passion. You've got to trust your gut when something appears to you. So here it is that I was reasonably successful in my PhD in molecular neurobiology. And I came back to my clinical training as in doing my Doctor of Medicine degree. And my very first patient was a heart transplant patient. And I thought, how cool is this? Only the patient wasn't in his room. And I trained in Richmond at Virginia Commonwealth University. And I asked the nurse, where is this patient? And he said, well, he's doing really well. He's out on the deck getting some air. And I didn't realize that was a euphemism for smoking. And here he was 10 days after a transplant, smoking through his trach tube. And it was pretty upsetting to see for an idealistic, young, aspiring physician.
Right.
And I told that story to my wife, and she said, you realize for the cost of that transplant, every kid in Richmond could have been vaccinated. And I told it to my attending, the supervising physician, and he said, really, if that upsets you, go talk to the dean. And the dean, sort of took me aside and said, you know what our logo is? And I said, it's like an upside down peace sign. He just shook his head. And it was in the days before you had to be nice and politically correct. He said, Perlin, you apparently were bright enough to get into medical school, but you have failed miserably at recognizing a stylized tobacco leaf. But I bet you know that we're a tobacco state. What you may not appreciate is that as a state institution, we've been warned by the legislature and the governor, if you take on tobacco, do so at your own peril. Now, he was actually really brave in an interesting way. Put his arm on my shoulder and said, if a student were to take that on, we wouldn't get in the way. There were a bunch of lessons in that, but for me, getting together with some faculty, we were able to make the institution smoke-free. And what I realized, that everything that drove me toward the love of individual service or caring for the individual patient could be magnified if he went into health policy. And so the sort of succession of jobs after that all stemmed from that moment where I realized that that was my calling.
And you said yes.
And I said yes.
I love it.
And something I think I mention all the time about our VA employees is how caring they are, and our I care values. It's not just about them, it's really who we are. It's who you are. It's why you get into healthcare to start with. And so you spent a lot of time in VA, some time at least in VA, and when I mentioned to some of my colleagues that you were going to be here, they almost mention your name in hushed tones, and I mean that mostly seriously. But that's because of the amount of respect that they have for you and the time that you spent here. And you spent the last almost 7+ years as the chair of the Special Medical Advisory Group, which is the oldest group that we have that advises the secretary and the undersecretary specifically about healthcare. So maybe you can talk a little bit about what you do in that role, and really how do you develop the rest of that group in order to help the VA to see medicine in a different light and continue to improve.
Well, let me address that, but also not miss the opportunity to call out Selena Miners, the team that really supports that. You know, if you go out to colleagues in healthcare or medicine or nursing and you ask, who is VA's board? Mm-hmm. Probably think they have a board like their health system has a board.
Right.
Well, as you know, we in VA, we have a very special board. It's called the Members of Congress.
That's right.
And it's a really big board, probably no more complex board anywhere for any organization. And for me, my interest in really growing the Special Medical Advisory Group was during that period I was serving as undersecretary. And I thought, what if we could get a group of the best and the brightest to come together to advise on veterans issues? And because of the mission that calls so many of us, our colleagues, to service in VA, we could call the best and the brightest to the Special Medical Advisory Group. And you know, during my period of leadership, was able to get people like Bob Brook, who ran RAND, the health practice, and Wayne Lerner, who ran the Rehab Institute of Chicago. At that time, Dr. Clancy was the head of the Agency for Healthcare Research and Quality. Former Secretary Peake was the Surgeon General of the Army. And as you can see, you assembled a coalition of individuals who were all singularly committed to helping the Secretary's office, and the Undersecretary, and leadership really think through challenging issues in a way that you just don't get the chance to do with Congress writ large, where you can have constructive dissent, tackle thorny issues, but also ask people who have experience in healthcare, health policy, and practice across the spectrum, whether it's nursing or respiratory therapy or podiatry or dentistry. All of these different essential health disciplines could come together and have a really good dialogue. And so my goal over these last few years that I've been privileged to chair has been to help recruit some of the best. And I'm pleased to say that Dr. Greg Meyer, who's succeeding me, Air Force veteran, leader of the clinical practices at Harvard, their chief medical officer, is just a spectacular individual. And today I think we had one of the best Special Medical Advisory Group meetings we've had on really key issues for VA, VHA, and most importantly, veterans.
Yeah, and it's an amazing amount of work to be accomplished in a fairly short period of time when everybody goes there with a common goal, and that's to improve health care for veterans. But even those discussions in their health, really the health care at large across the entirety of the United States. And so it's amazing to sit and listen to those meetings and in my own way be a little bit involved, but to really hear how the conversations with such a singular focus on taking care of veterans. And that's by folks that aren't even in the VA, but really shows the importance of that mission that we have.
Well, so many of those individuals have been affected by VA in various ways. Either they are themselves veterans, they have family members who are veterans, they have children who are active service members, or they, like 70% of physicians, 70% of physicians, they've received some portion of their training in VA. Like many of the nurses, they've received some portion of their training in VA. So they all have attachments, either quite directly or indirectly to VA, but to a person, are all committed to mission.
And we have a unique system that includes education, research, obviously our clinical work and our 4 missions and our 4th mission itself. And so the education piece is also key. I think a lot of the work that's done in special medical advisory group setting is to have those discussions about what's going on. And I know something really big's been happening in medicine lately since 2020, and that's the pandemic. And I know those discussions have been worthwhile, not just, again, to improve care for veterans, but improve care through all healthcare. So maybe you want to talk a little bit about how the pandemic discussions have happened, not only what's happening in SMAG, but also in your own kind of workspace.
Yeah, well, the great poet, philosopher, Yogi Berra said the future ain't what it used to be.
Right.
And COVID's not just changed the future, but it certainly accelerated so many things. Today we had a great discussion about education. Certainly healthcare is more virtualized. We've seen this move to the retailization. We've seen sicker patients move out of hospital. I think VA has been just a tremendous leader. Hospital at home is an idea that's coming to the rest of the world, but evolves from things that have been part of VA for 2 decades. And I know right now VA is the leader in that particular area. Well, I mention that because as healthcare changes, what does that mean for how we educate healthcare providers of all stripes? And I think the discussion today at the Special Medical Advisory Group was just terrific because VA is not just large and influential, but it actually can be leading and organizing. My own prediction is that workforce is going to be the defining challenge of the next half to full decade. Robin Begley, who's a member of the SMAG and the director of the Association of Nurse Leaders, actually shared a statistic that this year, 2022, there will be 500,000 retirements of nurses. There are over 100,000 new nurses entering, but that's a big deficit, and the deficit will grow to 1 million nurses short within the next 3 to 5 years. And that's really scary. And so VA has the capacity not only to be able to contribute to the national workforce, but to be able to help define how the curriculum evolves and how we address grand challenges. To me, that's VA at its best, is that it is not only 4 missions of caring directly for the veteran, the research, the education, the interest of veterans. During my tenure, the experience of 9/11 is forever etched in my mind. And happy to share a little story about that with you and what it meant to me and how it sort of shaped my career and my thinking. But the 5th unstated mission is that there is no system that is a better model for testing ideas about the evolution of healthcare than this veterans healthcare system is. Something that I was able to do, which is really built on ideas that I acquired during my tenure in VA, and one of the things I think VA can do is in that spirit of using the system as a model. For the last 15 and a half years, working at HCA Healthcare, it's a large health system, predominantly hospitals. And we quickly realized that by virtue of our footprint, we're going to have an awful lot of COVID patients. And by the end of 2020, it was clear we were heading to 121,000 COVID positive inpatients. And we thought, what can we do to accelerate the understanding of COVID and its treatment? Yeah. And we came up with this idea of the consortium of HCA and the Agency for Healthcare Research and Quality and academia for research generation. We said, okay, can we take the data from COVID patients and create a data set that we could partner with government and academic institutions to accelerate the understanding of COVID and its treatment? And today, regrettably, there have been close to 400,000 COVID positive inpatients whose data, de-identified of course, are now in that data set. And it's leading to answering extraordinary questions like disparities in health outcomes for women of color in terms of the co-occurrence of COVID and delivery. And that helps us understand maternal mortality better, which is one of the diseases of disparity. Women of color have 400% higher maternal mortality than white women. Latina women have about 150% mortality compared to white women. And so COVID has been a lens that has done, I think, three things. First, it's accelerated this movement to virtualization of healthcare. Second, it's created a platform for new models of data sharing. So whatever we learn in this, in the Charge initiative that I described, I think what the durable contribution is a new model for agile research partnerships. And I think VA is one of the few entities that can also operate at this scale, and the things that VA does. I mean, for example, we had a conversation at SMAG as well about hypertension and how the current understanding of hypertension and its treatment and all of the advances stemmed from VA. And the third is that as a large system, it's one of those things that's a natural platform for comparing practices, whether you use VISNs or hospitals. There's this thing called cluster randomized trials. And so whether it's testing a new clinical intervention or a new quality measure, there are very few places that can advance science as effectively. So that's what's come out of COVID for me, and in terms of the silver lining in what is otherwise an extremely ominous and dark cloud on the last few years.
Yeah, and I think sustainable into the future as we go to the endemic phase, and how do we move from that? And you mentioned, our telehealth, 1,500% increase from telehealth from the beginning of 20, and it sticks. It's sticking with our veteran patients. A lot of non-veteran systems are not sticking with it, and our veterans have found a way that they can continue care in their home where they never really thought they could do that previously, and that's pretty amazing. And again, VA is leading the way to get us to that point.
Yeah. Well, I think there are two pieces of magic. First, VA was an early adopter with telehealth, and that's part of the DNA. But I think the second is VA exerts a magic that exists in no other health system, period. And that is this capacity for the coordination of care. And that, to me, is the secret sauce. We know, when we look at the veteran population writ large, that veterans overall do better socioeconomically than the average American. But we know that not all veterans are ultimately eligible for VA care, and that winnows down.
Yeah.
And then when you winnow down to those that are using VA services in any given year, it is what, in the insurance parlance, one would call an adversely selected population, one that has disproportionate health challenges. I know there are a lot of younger veterans, and don't want to diminish the importance of their needs. Military service is a high-risk occupation, and we, VA, is an occupational health specialist, and I think that's precious. But VA has a concentration of older veterans and sicker veterans. My statistics are still current: 3 additional physical diagnoses, 2 additional mental health diagnoses compared to age-matched Americans. And many of the veterans using VA healthcare for service are poorer. These are individuals who categorically, in private sector, not veterans, but individuals with those characteristics, older, sicker, poorer, do poorly. And the fundamental breakdown is that there's no coordination of care. And so telehealth, the electronic health record, and the passion of VA colleagues really serving these individuals. The secret sauce is across the great geography of this country over time and over different situations, really tying it together. And that's why I think my hypothesis is that veterans have stuck more with telehealth than elsewhere. It's part of the glue.
Yeah, it truly is, and that's an opportunity too. I know telemental health is something that's really popular with a lot of my own cohort of veterans because they can do it from their own home without getting in the car to go. Peer counseling, being virtually, all those things are really great as well. You mentioned a lot of things in there, but I wanted to touch a little bit on EHR, and I know you're an early champion of electronic health record, and I'm assuming a lot of that is because of the data that's so ripe but in there. But so I'd love to hear your thoughts on it as we are continuing our progress towards our go lives or electronic health record modernization.
Yeah, well, I think this is such an exciting area. The EHR is kind of like the furnace in a house. You can't have a functional house without an EHR. But the really interesting part is, and you just mentioned the telehealth, we talked about the virtualization, is that there's this Internet of Things that surround it. And so one part of the action is making sure that your furnace is working and working well. And I'm as wedded as everyone was to Vista and My Healthy Vet and CPRS and all of those things. But got to move forward and make sure that we have systems that are interoperable. But the interoperability operates at two levels. One is the point-to-point of the system itself, and the other is this Internet of Things, where veterans, particularly younger veterans who are plugged in, can interoperate with devices, smartphones, and the like, and that we can use the exchange networks that are in the cloud to be able to move data around, whether it's VA to VA or whether it's a VA to community. Because again, I believe the secret sauce of all of VA is the coordination of care, and that takes an information liquidity that exists not just at the EHR level, but at this sort of smart home level that surrounds that, that necessary furnace.
Yeah, and we're a healthcare system that has so many more add-ons than any other healthcare system. A homeless program office, who, by the way, we've given iPads and iPhones to homeless veterans that are in the community so they have contact. But caregivers program that no other healthcare system has. We have all those things, and we have no way, if we don't have a way to wrap all those things together, then we don't have the way of having a continuum of care and coordinated care for each and every one of our veterans.
We talked today about the Digital Divide program, and I think that's just extraordinary. I mean, to undivide that divide by giving access to individuals who might not otherwise have access, whether it's because they're rural or because they're disadvantaged through homelessness. That's absolutely terrific, because it creates that that capacity for a systems approach to individuals with complex health needs.
Yeah, it's just wonderful things that that's involved in our mission, and it's so much about what we do and who we are as an organization. So I put a pin in talking about your post 9/11 time as the undersecretary and in this undersecretary's office. So I wanted to open it up to you to talk really about how that was. I wasn't in the VA then, but I'd be interested to hear, as we've dealt with the aftermath of COVID, hurricanes, volcanoes, earthquakes over the last 3 years, but appreciate hearing that.
Yeah, well, obviously it was a galvanizing time for the organization, for the country, obviously for our service members and veterans. But I remember I was in the third floor conference room, we're talking about the broader implementation of CPRS when the Twin Towers were struck. And I remember the secretary was in Hawaii and couldn't get back, and the undersecretary was ill, and I went up to the secretary's office. And, I will never forget, as certainly many will not, when the plane hit the Pentagon, those windows on the west side of the building percussed inward. And that is a sound that is indelibly etched. I was at that point the Chief Quality and Performance Officer, and I was headed toward becoming the Principal Deputy Undersecretary. And I asked, what can I do? And found myself shepherded off to help run support for the country as part of VA's fourth mission. And I went to work one day and didn't come back for roughly 30 days.
Wow.
And it was an extraordinary experience, honored to have that opportunity to serve. But in a strange way, I don't think I would have had the opportunity to be undersecretary. I had that set of conditions, and just saying yes, what can I do, transpired. But, a little known fact is that while, quote, planes weren't flying and transport wasn't running, because of VA, 6 C-130s loaded with every ventilator in the supply chain were headed to New York. 14 tractor trailers were headed to the Meadowlands with all sorts of supplies for what had been hoped to be a rescue, but ultimately a recovery operation. But it was illuminating and indelible to be closely connected with other governmental leaders, with leaders of the services, all in unified mission to protect the homeland and serve our country and support our service members as they went on to the missions that would unfold in Iraq and Afghanistan and beyond. So it was just very orienting, and that period of OEF, we were like you. We were an impassioned group. Used to have coffee with the secretary as undersecretary. 2 to 3 times a week. We'd do that somewhere between 5 and 5:30 in the morning. And typically the days then would end about 9:30 or 10 at night to a half day on Saturday. But if we ever felt tired, we'd take a trip out to what was then Walter Reed Army Medical Center and meet with some of the troops. And invariably, when they asked, what do you want to do when you get out, no matter how banged up, they'd say, I want to go back and serve back to my unit.
Yep.
And so however tired we felt, said, look, we can do more. It was a period where understand the depths of what service commitment meant, and one that reinforced to me, what the importance of this organization is. And if you ask why have I still been involved, it's really that simple. I've seen what the sacrifice has been, and how could you say no?
Yeah, and it's left an indelible mark on you. That has with everyone else, but it's interesting. I had never heard that story about VHA's fourth mission involvement during 9/11, and makes me even more proud of the great work that happens here every day. And having witnessed that over my time in my role with our fourth mission work in the pandemic and in geriatric care and in so many other ways has been utterly amazing. But I appreciate you sharing that story. It makes me even more proud of the great work that happens in that world.
Well, and I hope that circumstances are such that we never have to be called on again. But if we are, glad to know we're there. And obviously it's a volatile world around us.
Yeah. Well, I think along that topic, let's maybe talk about something. It's kind of hard to move on from that because it's such a great story about really what the VA does beyond just the everyday caring for our nation's veterans. But maybe you could talk about, since you've had a very varied career, and that's going to make you hard to beat as far as this question goes, but what is maybe like one of the proudest moments you've had, or something that just really sticks out of you as something that is just really heartfelt and you hold on to and never let go?
Well, I think that one is really at the top of the list. I know that's pretty somber, so I'll tell you a story in the other direction that where VA also exerted extraordinary leadership. It was during Katrina. And, just for the record, VA did extraordinary things. And while other residents of Louisiana and Mississippi, and particularly New Orleans, relocated, when veterans relocated, whether it was to Washington, D.C. or Washington State, because of our electronic health record at the time, they knew what medications they were on. They knew what their conditions were. But the funny story is this, is that I also disappeared for a few days, and my daughter, who was then about 7 or 8, and I tell you, we lived just outside of Annapolis, and she used to go to Navy camp during the summer. She asked my wife, well, where's Dad? And he said, he's working with the Army to help people with the storm. And my daughter looked up at her and said, the Army? I thought they were the bad guys. And my wife was just ashen. She said, Sarah, why would you ever say such a thing? She said, because at camp they taught us, go Army. Go Navy, beat Army, they're the bad guys. So I told that to, but then Secretary Nicholson had come into place, and he looked at me, shook his head, and said, John, the Jesuits were right. Give me a child's mind, they're yours for life.
Oh, my goodness.
But, it does demonstrate VA's place in really the fabric of our nation's healthcare and the fabric of our nation's preparedness. And it is pretty extraordinary what this organization can do.
Yeah, it truly is. I know you've been engaged in the fight against sepsis, so maybe you want to talk a bit about that as well.
Yeah, well, this is again built on skills that I learned in VA with the scale of data. But sepsis is one of the leading killers in the country, in hospitals, number 11 cause of death overall. But if you actually move to all ICUs, it's the number 3 cause of death, and in non-cardiac intensive care units, the number 1 cause of death. And time is life. Mm-hmm. For every hour in which the diagnosis of sepsis is delayed, your chance of dying goes up somewhere between 5 and 8%. And that means if you can get a couple of hours, you can save lives. So I got called to testify at the advent of World Sepsis Day at Congress before the Health, Education, Labor, and Pensions Committee. And I was there next to the family of Rory Stanton. Rory was a boy in New York City who presented to 3 different doctors, and sepsis wasn't recognized. And ultimately, unfortunately, he succumbed. his family really activated, and were able to build the Surviving Sepsis campaign. And it educated people about sepsis. And we brought that education program into our organization. We made about 40% improvement over 5 years. We said, wait a minute, let's look at how quickly we're detecting sepsis. And so we looked at when sepsis was diagnosed. And it turned out sepsis was diagnosed at shift change. Now, I feel pretty certain as a doctor that a natural phenomenon, albeit unhealthy one like sepsis, doesn't occur on an unnatural schedule like shift change.
Right.
And that meant we had magic time to really help save lives if we could get sepsis detected at some point other than when nurses and doctors and others got together to review data. And so we took this data that came off of patients as a natural byproduct and used it to try to spot sepsis. We used administrative data like how old the patient was, demographic data, and we used clinical data like what labs, what medications, and location data, et cetera, so that we could actually get a real-time scan. And we didn't bring the data back to the bedside, to the doctors and nurses and say, your patient has sepsis. We said, these are the features of sepsis, and this is what your patient has. What do you want to do? And we were able, in 1 year alone, to improve by roughly 24%.
Wow.
And since the inception of this program called SPOT, Sepsis Prediction and Optimization of Therapy, which actually won an Eisenberg Innovation Award, National Innovation Award, saved about 8,000 lives. And I think one of the best compliments from a doctor was that, this individual said, using the electronic health record is kind of a pain, but when it helps you see something you wouldn't have seen and save a life, it makes it all worthwhile. And that's where my most recent organization, HCA Healthcare and VA, have the capacity to use data at scale, to be learning health systems. So, we should never think of the life of data as being from start to finish. We should think of it as being a circle. The data are created when we interact with a patient. And those data may be a blood test, and it may be, what is the patient's sodium. But that's only part of the story. When was that blood test taken? Who took that blood test? Where was it taken? Et cetera. Those are all what are sometimes referred to as data exhaust. But that's the kind of information that can help you not only serve patients by bringing it back full circle to the bedside, but by bringing it back into the system to improve safety and quality and efficiency, and even, I would say veteran-centeredness or compassion, because you can create systems that are more responsive to the individuals that you're intent on serving.
Yeah, that gets back to my new catchphrase, which is intentional. It's an intentional approach to it to be able to find those solutions and save lives on top of it. It's pretty amazing. We've talked a lot about kind of your past roles. Let's talk a little bit about your future role. Recently named as the President and CEO of the Joint Commission. I'm sure most of our viewers know who the Joint Commission is, specifically in our hospitals, but maybe you could talk a little bit about what your role is and what you kind of see your role being in the future in your time there.
Yeah, well, first off, I should mention that the attraction to Joint Commission is similar to the attraction to VA. Obviously, VA serves a very unique constituency,
Right.
But the notion of service, the notion of improvement for improvement's sake, the notion of creating a healthier and better society, that's really what attracted me there.
Right.
And I think I bring a unique set of skills. I've been in academia, been in VA and government sector, and I've been in private sector.
Right.
Most importantly, I've been at the front lines of care. Proud to say I was the first undersecretary that had a continuity clinic at the Washington VA.
Great.
But I understand healthcare operations, and so my goal and job is to inspire and sort of choreograph. And the areas that I want to inspire and choreograph and actually direct my priorities are in a handful of buckets. So the first four are these. First is equity. I'll just name what the four are. So equity, predictive analytics and data science, decarbonization and sustainability, and workforce.
Great.
And operationally making the Joint Commission survey process better. So let me talk a little bit about each of those sequentially. So equity. I built a career on safety and quality improvement, and I used to put safety as the foundation ever since the Institute of Medicine came out with the attributes of the ideal health system: safe, timely, effective, efficient, equitable, and patient-centered. And I know here we say veteran-centered. Those are great. And I always thought as a sort of mental model that safety was the foundation. But the lens of COVID really sharpened things, and we saw such disparate outcomes that really equity has to be the focus. You don't get a chance for safety if you're not included. And so inclusion and driving that is one of the things that I hope to do through an equity initiative. More to come on that. Data science, for all the reasons I just mentioned.
Yeah.
We need to move to a post-dashboard age. We don't want to know what happened in the last quarter. We want predictive analytics that tell us how to play the best game in the next quarter. And that's one of the areas where VA excels. And I think we can do some exciting things in Joint Commission, both independently and collaboratively.
Great.
The third area of decarbonization. Here are 3 facts that I didn't know, have to confess. That roughly 9% of the carbon footprint of our country comes from healthcare. That's huge.
Did not know that.
2, outside of our country, if healthcare were a country, it would be the 4th biggest polluter worldwide. And 3rd, climate change is not just about sustainability, but it's fundamentally an equity issue. Why is that? Well, the people who are least able to avoid the effects of climate change, of excessive heat, damaging storms, or extreme cold, are those individuals with the greatest degree of social vulnerabilities, which co-vary with all of the disparities that we well know. So I'm very committed to this. And there's an International Greenhouse Gas Convention, and it talks about 3 things: the stuff we do, the stuff we burn, and the stuff we buy. And the stuff we do in healthcare, turns out things like desflurane and anesthetic agent are incredibly damaging to the atmosphere. And so recovering that and using less is an important area. We're also huge consumers of water for dialysis units, using traditional methods, et cetera. And that's part of that scope 1. Scope 2, the stuff we burn. Some entities are blessed with brand new infrastructure. I know VA is not, and I know you're working importantly with the Air Commission on new opportunities, but that's an opportunity. One of our biggest opportunities is scope 3, the stuff we buy. And I have to, at the Joint Commission, look carefully at what we require in terms of single uses, because that leads to excess consumption. And so this is a dialogue that's an important one. The President has put out 2 executive orders, one of which is 50% reduction in carbon by 2030 on net zero by 2050. These are ambitious, and we have opportunities in healthcare. And so I think it's one of the things where we have to look inwardly from healthcare and hope to lead that. I mentioned the workforce challenges, and I won't elaborate on that. And I'll just mention as a 5th is improving the survey process. Would like to part in the interest of decarbonization, find out how we can do more hybrid surveys, do some of the desk review remotely using broader swaths of data, and advanced analytics so we can find out what's really predictive. Next layer, answer policy questions that are important. I've had the privilege of being on the Medicare Payment Advisory Commission. Right. So many times the question comes up, gee, I wish we could survey that. Well, for virtually no cost, the Joint Commission's there. We can answer some of those questions. 3rd level, we'd like to give recognition to entities that are doing really well using a combination of our own survey findings and external data. And the 4th level have learning metrics. So one of the ideas, I'll provide a little early insight sneak peek, is this idea of equity tracers, where for every majority population patient we pull for a tracer through the system, very familiar to all of you who've been part of a Joint Commission survey, pull someone from a non-majority population. And if they fare well, back to that 3rd layer, give recognition. They don't give private guidance back, help to inspire change through our survey process. So those are my priority areas. And it's really exciting to have a great team there, individuals who are mission-oriented. And my goal is to be very collaborative with government, collaborative with other partners, but ultimately collaborative in a way that advances a mission that all individuals across all places receive the best health outcomes possible.
Well, I'll tell you on behalf of maybe not all the employees, because I haven't asked all the employees, but on behalf of a lot of our leadership team, we're very proud of you that you have taken on this role and this responsibility. I can also speak for us that we look forward to working with you in this new role, and I think there are some great opportunities for us to partner together to solve a lot more problems than we could have separately. So we're really looking forward to that as well.
We'll take you up on that.
Great. We're coming towards the end of the time with our show. So I wanted to leave you an opportunity to be able to offer some final thoughts before we close.
Well, first let me just say what a privilege it is to be with you and to be at VA for all the reasons that I think are readily apparent. You know why I'm here, but I also know why you're here, and why you personally are here, John, and why our service members often choose VA as a career, and why individuals who are serving veterans across VA, and I mean VA writ large, all of the elements of VA. But to those who are in healthcare, know that it's been a period of turbulence in your personal lives, in your professional lives. I just want to join you in thanking those individuals. Know you're here because of mission, and one of the great things that's at the Special Medical Advisory Group is that we get to hear the stories, and you may not hear back the thanks that all of those illustrious members who hope to support VA in its work want to communicate on behalf of all of those individuals. Our thanks to those individuals of VA who are really living the mission, serving veterans, doing great things, and creating a system that's a model for our country.
My gosh, thank you so much. I could sit and talk to you all day, and I really appreciate you taking time out of your busy schedule to be with us, and I know it's going to get even busier in the future. And thank you again for all you've done for veterans, for the VA, and what you'll continue to do not only for VA, but healthcare at large. Thanks again for being with us.
Thank you for having me. It's an honor.
Thank you very much.
Thanks.
Thanks for joining us, and thank you for watching, and thank you for all you do in caring for our nation's veterans.
Hope you enjoyed today's conversation. A huge thank you to all of you for listening, to Dr. Perlin for his time, and our broadcast and production team for their support. See you next time.